A stroke is the serious medical condition that occurs when the blood supply to a part of the brain is interrupted, causing brain cells to die. A stroke can cause permanent brain damage, disability, or even death. According to the World Health Organization, stroke is the second leading cause of death and the third leading cause of disability worldwide. However, many strokes can be prevented or treated if they are recognized and treated quickly. That's why it's important to know the early warning signs of a stroke, which may appear days or weeks before a major stroke happens. These signs may indicate that there is a problem with the blood vessels or the blood flow in the brain, and they should not be ignored. Recognizing these signs and symptoms can help you get help as quickly as possible and potentially save your life or someone else's. So in this video, we will talk about 9 of these signs. Number 1. High blood pressure. High blood pressure is one of the main risk factors for stroke. A high blood pressure can damage the walls of the arteries and make them more prone to narrowing or clotting. The problem here is that high blood pressure often has no symptoms, so it's important to check your blood pressure regularly and follow your doctor's advice on how to lower it if it's too high. Some ways to lower your blood pressure include reducing salt intake, eating more fruits and vegetables, exercising regularly, quitting smoking, limiting alcohol consumption, managing stress, and taking medications as prescribed by your doctor. Number 2. Irregular heartbeat. Irregular heartbeat, also known as atrial fibrillation, is another risk factor for stroke. It can cause blood clots to form in the heart and travel to the brain. It is estimated that atrial fibrillation affects about 2% of people under 65 and about 9% of people over 65. Number 3. Fatigue, mood changes, or memory problems. These may be subtle signs of chronic cerebrovascular disease, which is a condition that affects the blood vessels in the brain over time and increases the risk of stroke. Chronic cerebrovascular disease can cause damage to brain cells and impair cognitive functions such as thinking, reasoning, and remembering. This disease can be caused by various factors, such as aging, high blood pressure, high cholesterol, diabetes, smoking, or heart disease. To prevent chronic cerebrovascular disease and strokes, it's important to follow a healthy lifestyle and treat any underlying conditions that may affect your blood vessels or your brain. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Weakness or numbness in the face, arm or leg, especially on one side of the body. This may be caused by a transient ischemic attack, TIA, which is a temporary blockage of blood flow to the brain. A TIA is often called a mini stroke because it lasts only a few minutes and does not cause permanent damage. However, a TIA is a serious warning sign that a major stroke may happen soon. It is estimated that about 1 in 3 people who have a TIA will have a stroke within a year. A TIA can be caused by various factors, such as high blood pressure, high cholesterol, diabetes, smoking, or heart disease. To prevent transient ischemic attacks and strokes, it's important to control these risk factors and take medications as prescribed by your doctor. You should also seek medical attention as soon as possible if you experience any symptoms of a TIA. Number 5. Trouble speaking or understanding what others are saying. You may experience confusion, slurred speech, or difficulty finding the right words. This may also be caused by a TIA or by an ischemic stroke, which is the most common type of stroke. An ischemic stroke occurs when a blood clot blocks an artery that supplies blood to the brain. The clot can form in the artery itself or travel from another part of the body, such as the heart or the neck. An ischemic stroke can affect different parts of the brain that control language, such as Broca's area responsible for speech production or Wernicke's area responsible for speech comprehension. Number 6. Vision problems. Vision problems such as blurred vision, double vision, or loss of vision in one or both eyes can be also caused by a TIA or by an ischemic stroke that affects the part of the brain that controls vision. The affected area can be either the occipital lobe, visual processing, or the parietal lobe, visual perception. Vision problems can also be caused by other conditions, such as glaucoma, cataracts, macular degeneration, or diabetic retinopathy. To prevent vision problems and strokes, it's important to have regular eye exams, wear glasses or contacts if needed, control blood sugar levels if you have diabetes, and treat any eye diseases or infections. Number 7. Severe headache. Severe headache, which may be accompanied by vomiting, dizziness, or altered consciousness, may indicate that you are having a hemorrhagic stroke, which is less common but more deadly than an ischemic stroke. A hemorrhagic stroke occurs when an artery in the brain ruptures and bleeds into the surrounding tissue. The bleeding can increase the pressure inside the skull and damage the brain cells. A hemorrhagic stroke can be caused by various factors, such as high blood pressure, aneurysms, which are balloon-like bulges in the arteries, arteriovenous malformations, which are abnormal connections between arteries and veins, trauma, tumors, or blood disorders. To prevent hemorrhagic strokes, it's important to monitor and lower your blood pressure if it's too high, avoid smoking and excessive alcohol consumption, and seek medical attention if you have any symptoms of such as sudden severe headache or seizures. Number 8. Dizziness, loss of balance, or trouble walking. This may also be caused by a TIA or by an ischemic stroke that affects the part of the brain that controls coordination and movement. The affected area can be either the cerebellum, which affects balance and coordination, or the brainstem, which affects vital functions and motor control. Number 9. Diabetes. Diabetes is another main risk factor for stroke. Diabetes can affect the blood vessels and increase the risk of ischemic stroke. Other than that, diabetes can also increase the risk of hemorrhagic stroke by weakening the blood vessels in the brain. Knowing these early warning signs of a stroke can help you act fast and seek medical attention as soon as possible. The sooner you get treatment for a stroke, the better your chances of survival and recovery. Getting treatment within 3 hours of having an ischemic stroke can reduce disability and improve outcomes. Getting treatment within 4 hours of having a hemorrhagic stroke can also reduce mortality and disability. Some treatments for stroke are only effective if given within a certain time window after symptoms start. For example, clot-busting drugs can dissolve clots and restore blood flow to the brain, but they can only be given within 4.5 hours of having an ischemic stroke. Similarly, surgery to remove clots or repair bleeding vessels can only be done within a certain time frame after having a stroke. Therefore, it's crucial to recognize the early warning signs of a stroke and call 911 or your local emergency number immediately if you or someone you know is experiencing them. Don't wait to see if the symptoms go away or improve. Every minute counts. Remember the acronym FAST to help you identify the most common signs of a stroke and what to do. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to rise? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Time. If you observe any of these signs, call 911 or your local emergency number right away. By knowing the early warning signs of a stroke and acting fast, you can save a life and prevent disability. Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.